previously, as the slides were not showing, understanding lifestyle disease. These are the general lifestyle problems: diabetes, overweight, and cholesterol, hypertension, heart disease, cancer, obesity. But generally, we don't disclose or we don't discuss about the problem of mental illness. So today I'm going to talk about mental wellness, which is through Ayurvedic protocol, and how can we intervene and how can we cure mental problems through Ayurveda and the integrative approach with allopathic medicine or modern and conventional medicine I will be discussing today. These are the percentage of mental disorders that I just discussed few minutes back. 13 to 17 years of people, so, students or teenagers and toddlers, not toddlers, teenagers and adolescents who are generally 7.3% suffering through mental health. And the others are depressive disorders, 33.8%, anxiety disorder, we generally know about this, schizophrenia is a bit of higher percentage disorder, but intellectual disability is a very crucial, it's a very important point of discussion because in mental health disorders, we generally don't consider intellectual disability. It is probably present to every people more than 10.8%, but they don't come into surface because we people don't consider intellectual disability as a problem. Ayurvedic perspective, uh, three basic gunas we consider in Ayurveda which controls mind, which we can assess the mind, quality of mind through these three gunas, is sattva, raja and tamas. So
Actually, the
every
slides
people,
are not. Excuse me, the slides are not again moving. It is
okay,
still at slide number 4. I think when the whole screen just your slides are visible and nothing like you or the people other are not visible,
Yeah,
then
ma'am.
they will move.
Yeah,
okay,
now it's moving.
Now yeah, it
okay, then
has
I'm
moved now. You have moved to
share.
next one.
Yeah, yeah, yeah.
Yes, yeah. So you have to move from that place from where you just moved it.
Okay, 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 I understand. Is it
Yo, now we are now in number 8
this way? Is
slide.
it moving?
Yeah, this way it's moving.
Okay,
Yeah,
okay,
you
I
just
am
yeah,
in
start, yeah,
sixth
okay.
page now.
Okay, okay.
This
Please
is
go
okay,
ahead.
no?
Yeah, yeah, that's okay.
Okay. So the three mental gunas are sattva, raja, and tama. This is very basic through which we can understand the mental condition of a person. There are many other techniques, but I am into a very basic state because understanding mental health conditions through Ayurveda is a very crucial thing, and the basic has to be very much clear. So, tamas, generally the person's mental character is dull, depressed, repressed, damaged, neglected, denied, and underactive. Most people who are lying on the couch, who are not thinking too much, who doesn't have mental clarity, who thinks that I'll do work later on, and I'm confused, I'm unable to make understand what I'm thinking. This comes under tamagunas. This is the vitiated condition. Now, rajagunas, this is a desired condition. So, the overexcitement of a person to do something. Suppose it's very simple work like going to a market. Some person is very overexcited. From early in the morning, I have to walk to the market. I have to do this. I have to do that. I have to make list. These kind of people falls under rajagunas. They are maniac. I have to do this. Hasn't been done. I have to do that as fast as I can. I have to do it perfectly. I'm very obsessive. I'm obsessed about my dress. I'm obsessed about my studies. These are the qualities of rajagunas. Now, sattva is a very delicate state where rajagunas and tamagunas are both present but in a very balanced state. So, a person will not take drastic decisions, yet the person will take decision with very much clarity. A person will not rush to a walk, but the person will not slip back to the couch. So this basic maintenance is a very tough for a person to maintain this sattvic stage. So whenever we are having a disbalanced condition of sattva, raja and tama, we are finding different kind of mental disorders. So another very important entity comes into play. This is the physiological entities of our body. Vata, Pitta, Kapha. This is very basic, but this is very vital to understand as well because mental health conditions depend upon these three entities. Vata, as we understand, very simple is Vayu. Vayu is lightweight. So what does Vayu do? It flows. It winds. It is a wind which moves. The wind that moves inside our body is not exactly wind that is outside. It is inside like a pranvayu. The breath that we are taking. This is Vayu. Now Pitta. Pitta, what we consider is the flame, is the fire inside our body. Now there is no detailed fire inside our body, but the hormones, the digestive system, this we generally consider under Pitta. And Kapha. Kapha is the phlegm, the white part inside the body which supports the system, which supports the lymphatic systems and the WBCs and the brain, the grey matter, the white matter. This is the cuff which supports Vata and Pitta. This is very slimming, this is very nurturing, and this is very soft and cold in nature. So these are the three basic physiological entities of our body. So whenever we are having Sattva, Raja and Tama disbalance, we'll find Vata Pitta Kapha disbalance as well inside our body. So what Ayurvedic treatment protocol considers are, they have to balance Sattva, Raja, Tama as well as Vata Pitta Kapha. They are interrelated. Whenever I am balancing Vata Pitta Kapha, Sattva, Raja, Tama is getting balanced. When again I am balancing Sattva, Raja, Tama, Vayu Pitta Kapha is getting balanced. There is a very small classification I've considered from Charak Samhita. There are a lot of details, but I've considered Unmad, Unmada, Apasmara, Attatavinivesh, and Vishal. Unmada is considered insanity or psychosis. This is in a higher stage, but in a medium and in a lower stage, Ayurvedic intervention is very wonderful. Apasmara is epilepsy, seizures, loss of consciousness, and confusion. But persons don't need to have epileptic seizures to consider as apasmara, because in our clinical practice in government hospitals, lot of people come who are having very uh, temporary, very acute kind of seizures, and in a few seconds they are recovering and they are not intervening any kind of treatment, but they are absolutely fine and their tests are all normal. But this kind of person are feeling irritable. They are very much conscious and aware that they need to visit the doctor. That's why they come to us. At Tantranivesh, this we can find in more or less every person, obsessed in very small things. Even closing a door, switching off a fan or switching off a gas can also be obsession. We can have a false belief as well that I am a very good doctor, I'm a very good engineer, I'm a very good mother, I'm a very good son, I'm a very good daughter. This is also a false belief that we keep inside ourselves. OCD, obsessive compulsive disorder. We repeatedly do one thing when we believe something that whether false or true, we believe that this is true. This is OCD and that comes under Attanta communication. Vishada is depression. Vishada depression mostly, most people, not all, has experienced, and this is a very irritable state because you are unable to communicate at all with anybody. You don't feel like getting down from the bed and asking for a glass of water. This is how depression feels like, and this is a very good luck if a person comes to the clinic and says that, madam, I'm feeling depressive, I'm having depressive episodes. So this is the classical Charak Samhita description. Now we can go through the modern description just for a glance. That is psychosis, schizophrenia, mood disorders. This all comes under major mental illness. So when these things happen to the chronic stage, the person immediately needs to be hospitalized. Neurosis in a minor mental disorder, anxiety neurosis, in our clinic, a lot of patients come, but they don't say about anxiety neurosis. They say about the supported other problems like body ache, muscle cramp, headache, sleeplessness. They come with this kind of symptoms, but when we diagnose, we find out that they are having anxiety neurosis, obsessive compulsive disorder, as I have said, phobia. I'm afraid of water. I'm afraid of air. I'm afraid of lightning. I'm afraid of thunder. I'm afraid of loud sounds. This all comes under phobia. Personality disorder. This we can find in every stage. Narcissistic personality disorder, empathic personality disorder, bipolar disorder. This patients are everywhere. We just don't see either, or we cannot detect. Now, the three important reasons why these disorders are taking place. These also explained in Charak Samhita. So interesting, Charak Samhita in Sutrasthana, such an old book. This is our Gita, this is our Bible. We know everything. We have known everything from Charak Samhita. At that point of time, they have sorted out three causes from which all the mental disorders we can understand and we can detect. So one is asatma indriya artha samyog. Asatma, what do we mean by asatma? This is not sattva, this is not good power health. Indriya artha. Indriya means all the sense organs. Artha means the subject. What does our sense organs do? They perceive the objects and then the brain utilizes that. So our senses are not interacting normally with the subjects. This is asatma indriyatma samyog. We are using mobile mindlessly. Our eyes are not acting properly through the mobiles, and we are having brain jam, brain fog. We are unable to concentrate. We are unable to understand things which are very easy. Someone is explaining to me something for 2 minutes. I am unable to concentrate. So this is practical example of asatma indriyatma samyog. Pragnaparad. What is Pragnaparad? Intellectual crime. So we have heard about so many crimes, but intellectual crime is what Tarak Samhita has explained us. They say that when we are acting knowingly against one's own wisdom. I know I should not hurt her mentally. He might be very bad, he might be very rude, but when I am hurting his intellect, when knowingly, that is my intellectual crime. When I'm doing to one person, it's okay. When I'm doing to second person, it's okay. When I'm repeatedly doing to every person, that means I am having psychological disorder. That I have to confirm. Otherwise, my family members, my friends have to confirm that when this person is insulting every other person, that means her mental stability is not good. Now, Parinam. Parinam, what? Parinam is a very general term, but in this position, parinam means normal process of uh, aging, either normal process of deteriorating, that I can say. Normal process of deteriorating in case of aging, in case of burning out, working excessively and burning out, midlife crisis. Like after age of 40, after age of 45, we suddenly feel that we have to relive our life. We have to get the best things that we have not got in our early days. We give all our energies to find out how I have to survive more successfully. This generally comes after 40 to 45. This is midlife crisis. This is also a psychological imbalance. So, what my position is, what my mental status is, I can't force myself to go beyond that. If I think that I'll now, if I have an income of 5,000 and next month I'm planning to go to London. So, this is not possible. This is how our brain is using our intellectual as a aparat. As a sorry, I'm extremely sorry. I have just changed my topic. Parinam is midlife crisis. So again, what I'm discussing is. Am I in the right place? I'm sorry to get interrupted. I'm extremely sorry. So, Asatma
No
Indriyartha Samyog,
problem.
Pragnaparat, and Parinam. These three are the causes that has been said by Charak Samhita, which we can detect the person's present problem through these three. Through aging, I'm having dementia. So dementia is a natural process. That is a parinam. We have to
Hello.
accept it. If somebody is unable to accept, that
Hello.
means the person is going through the causes of
Hello.
parinam.
Hello.
Next comes
हाँ सुना दे.
the eight sensory systems through which
हाँ बोलिए.
we are going through the pragnaparat intellectual crime. The vision, that I
हाँ,
have
मैं
said is
आपके
the
बीच से
mobile
बात की थी तो
touch.
मेरा जो वेट
Either
का
I'm
प्रॉब्लम चल रहा था उसके लिए
sitting
बहुत
in
दिन
the
हो गया है।
excessive AC.
हाँ, तो
That is,
अभी
I,
आज
mean,
ही वो
I
पेमेंट
need
करेंगे, वो
excessive
रिमूव कर
cold
दिए जो पेनल्टी का
feelings to
50% चार्जेस
feel
थे।
better.
आपकी
Not
टीम से अभी ही
in
बात कर ली
case of
थी
health,
व्हाट्सएप
but
में,
in
वो
case of
मुझे
mind.
रिमूव कर दिया, मैं अभी
I'm
कर रही
sitting
हूँ।
in excessive hot temperature. There are people who are
मैं तो अभी
who are getting
ऑफिस से
too much of
वहाँ कंफर्म टाइम
feeling
बिफोर
hot.
6 हो
They are
जाएगा, ठीक है,
having
मैं
too
आपको
much
ऐसे
of
ही बोल
sweat.
सकती हूँ।
They are still
बिफोर 6 हो
preferring to
जाएगा।
sit in hot weather. This is a psychological problem. Taste. Somebody wants to only eat rich food,
हाँ हाँ, इसलिए वही आपको
spicy
टीम
food.
बोल
This
रही,
is
मैं
a
अभी
psychological issue.
जा रही हूँ रूम
The
को, जाके
person,
करवा देती
this
हूँ।
nervosa bulimia or nervosa,
हाँ हाँ,
anorexia
डेफिनेटली
nervosa, the person
कंटिन्यू।
always wants to either eat excessively or not eat. This is a taste problem. That means the patient is facing psychological issues. Hearing problem. I'm hearing a sound of a bird. I'm hearing a sound of a child. Nobody is hearing, but I am hearing. This is a hearing problem. Vestibular problem. I'm feeling like I'm always moving. I'm sitting still, but I'm feeling like I'm moving. This is a vestibular problem. Smell. I'm always feeling like smelling fishy. Fish kind of smell all over. This is a psychological problem. So this comes under the causes, where we can assess how the patient is feeling. This is an example of asattvendriya samyog. I am feeling one and I am showing one. I am feeling happy, but I am showing sad. I am feeling sad, but I am showing happy. Here's an example. Here's a parinam example, that I am having dementia in my brain, that the brain is lagging, but I am feeling like I am not well. I am not responding to things. I am not talking properly. But this is the reason of parinam. The brain is getting depreciated. Menopausal syndrome. I am getting hyperactivated. I am getting irritated. These are all the mental issues, but these are having due to menopause, because this is the parinam of the human being, parinam of the woman. Now the Ayurvedic intervention, I can come over the treatment. We have to balance the Vata dosha, Pitta dosha and Kapha dosha. This is very easy. Vata dosha, we have to regulate through warmth, stability, routine and grounding. I am very much hyperactive. This is a Vata dosha condition. I need to ground. I have to sit still for 2 minutes. Then I can balance the Vata dosha. Pitta dosha. I am having extremely overheated body. I'm having anger. I'm having excessive workload and I'm unable to manage it. What I have to do? I have to stay in a cool place. I have to calm down my agni. I have to calm down my hormones that are very much excited. Hormones means not only just oxytocin, not just progesterone and oxytocin, but also cortisol levels, but also serotonin levels. I have to adjust. I have to also adjust dopamine levels. It is not just only by medicine. I have to adjust through some balance, like calming down myself, eating non-spicy food, non-oily food. I have to take cold baths. This can calm down my high agni or high fire inside me. Now, kapha dosha. How can I balance kapha dosha? Kapha dosha balance is much easier, because once you move, you start moving. Kapha dosha, stagnant kapha dosha starts moving. When you are depressed, your kapha dosha is imbalanced. When you start moving, you go for a half an hour walk. When you come back, you feel better. This is a very natural process of balancing kapha dosha. You just go for a yogasana. You go, just Madam Gulati Madam has just explained how exercise, how workouts and how yogasana helps us control our COPD disease. COPD. So this is another example of kapha dosha. If we start moving, if we start having a warm bath, we take warm food, kapha dosha gets balanced. So few drugs, few medicinal herbs, these are very simple, but I think this has to be noted by every human being, irrespective of Ayurvedic doctors or medical person. That is ashwagandha. This is, though this is very common, but we need to know the usage of ashwagandha. It's not that when I feel good, I am living a normal life, I'll continuously take ashwagandha just because there are a lot of advertisements. But I have to understand that ashwagandha is a neuroprotective drug. It modulates GABA peptide inside GABA receptors. It has an anxiolytic effect. So when I'm extremely feeling anxious, when I am extremely feeling tensed, I can opt ashwagandha. I can opt the medicines that comes under ashwagandha. Very simple medicines. Ashwagandha churna, ashwagandha capsules, tablets. Not for long run. Let's say for 7 days, for 15 days, for 1 month. I will surely get result. I'm having sleepless nights. I can take ashwagandha. But this is of course after showing a prescribed doctor, not just by our own mind. Brahmi. Brahmi is Becocomoleri. This is a very common drug, a common plant in West Bengal. Generally, we eat with rice. We can buy in the vegetable markets and we can cook and eat with rice. There are a lot of people who says if you give this in childhood, the brain, the person, the baby will have high intelligence. Now, this Brahmi we use as a medicine to people who are having neurological disorders. This is a very small plant which we can cook whole in a whole way. Either we can pressure cook and drink the whole water in the plant, or we can take the medicinal either in capsule or powder form that is also available in the market. This is Brahmi. This is also a neuroprotectant. This, this enhances the cognitive function and memory. So cognitive function, what is cognitive function? I can think properly, I can assess properly. If somebody is misguiding me, I can understand this person is misguiding me. So these are the actions of the brain. If my brain is weak, if my brain is dull, it's not working properly, I won't be able to understand how a person is guiding me. I'll believe everyone. This might be, uh, this might seem like this is a very common character of many people, but no. If my brain has a clarity, I will easily understand who is making me trouble and who is really helping me. This also helps in reducing the oxidative stress. So that is another issue, that is oxidation, and that increases the autoimmune power of our body. That is a separate chapter. Next, let's go to next plant, that is Jatamansi. This is another interesting plant because this stabilizes vata. How? This reduces the neuronal excitability through GABA receptors. What happens is when I take this immediately calms down my exciting nerves in the brain. I'm extremely excited, I'm unable to take decision, or somebody very close to me has hurted me, or my very close person has died or left me. So my brain is not working. I'm either excited or I'm depressed or I'm in an anxiety position. If I take Jatamansi, I will have a good sleep. I will bring down my tension. If I have a regular dose or immediate acute dose will also work. In our clinic, when a person comes with high excitement, whatever hospital combination of medicines we have, we immediately prescribe to the patient. And the patient says, yes, half an hour after, I am feeling better. So these we have tried in our hospital setup. Shankapushpi, this is also a neuroprotective drug. Same, it functions equally like the other ones. Now next is Triphala. Triphala is Amla, Haritaki, Baira. This is very common, very common. This is without any Ayurvedic prescription. Most of the people knows about Triphala. Amlaki is readily available in the market. But the actions of Triphala is more in depth. This is no doubt immunomodulatory, but what happens is it detoxifies our body. How? There is a gut brain axis inside our body. If we feel helpless, if we feel anxious, there is some kind of trouble that goes inside our stomach. Either we are facing IBS, or we are facing constipation, or we are facing extreme hyperacidity. These things happen when we are not in a stable condition of mind. So this Triphala balances the mind, the gut-brain axis. This is very crucial when a person is suffering through long-term chronic mental health disorder. The person comes and tells that I am having irritable bowel syndrome. But whenever we are taking history, we are seeing that the person is suffering through long-term trauma. What kind of trauma? It's not that somebody is beating me, but some kind of problem, either financial or family related, the person is continuously suffering it silently. So whenever the person is suffering it silently, all the mental health issues are attacking our gut system. The gut system cannot get relaxed. It is always in a tensed position. The same way our brain is tensed, the same way our gut is tensed. So this Triphala helps to relax our gut system. Whenever we feel better in our gut, we feel better in our brain. Next is Panchakarma therapy. The five therapies, very important five therapies. Uh, they can be used in various diseases, but specifically in mental health disorder. Viraj and Vasti, we have seen in our hospital setup, it works very efficiently. There are specific doctors for Panchakarma, was Panchakarma specialist. Woman is through vomiting. Virachan is through emesis. And Vasti is through rectal supply of medicines. These are the three basic treatments of Panchakarma through which patients recover very fast. Next is Shirodhara that most of the people know. This helps to calm down our nervous system. For a long-standing 7-day treatment, it affects very good. But of course, this is a external treatment, so a person with high or moderate disease won't get immediate recovery. But yes, the person will definitely feel relaxed and feel better from the state when the patient is coming to the hospital or coming meeting the doctor. This is Nasya. Nasya is taking medication through nose. Nose is the only pathway which directly connects to the brain or our nervous system. So whenever we are giving medicines to activate our brain system through Nasya, through nose, the patient is improving drastically. All the Uttachatrugata diseases from upper chest, neck, head, eyes, ears, all the diseases can be cured through Nasya. But of course, through specific medication and through specific doctor's intervention and Panchakarma specialists. Not just everybody can do, and we as a doctor won't suggest that without specialization or without huge practice, the person should pursue this. Snehan Shwetam, this is the body massage and body fomentation with specific oils. This can also be done, but these are all external applications, but patients improve drastically, those who are suffering from mental health disorders. Next is yoga posture. This is an undeniable fact that wherever we are following yogas, the brain, blood circulation in the brain is changing. The neurotransmitters are acting very fast, and we are feeling immediately that we are more relaxed and we are recovering from the depressive state very fast. These are very common exercises which are Viparit Karni, which is you can see the legs are upward and the head is downward. That means the blood is fully circulating in the brain. Savasana is another very relaxing posture. If we can focus on our breath and relax for 5 minutes, this can uh, have an efficient effect. Tadasana, the full body blood circulation will act over to this asana. Vajrasana, as we know, after eating, we can most of the people can follow, even they follow Vajrasana, Marjariasana that we know, cat cow position. This is often shown in TVs and YouTube videos as a fancy asana, but this is a very important asana. This helps to relax our brain system. Next is integration with modern medicine. The four happy hormones are oxytocin, serotonin, endorphins, and dopamine. These four are the basic hormones that if they are elevated, the person is bound to feel happy. Now, I have mentioned a small comparison between Ayurveda and modern psychiatry. What does Ayurveda do? They do a holistic treatment that I have explained just now. You have to do yogasana, you have to follow dinacharya. The whole day's routine is fixed in Charak Samhita. You have to focus on that. You have to eat on healthy. You have to eat healthy. You have to think healthy. That the doctor will assess your problems through Vata Pitta Kapha, Sattva Raja Tama. They will suggest you medicines. You have to take that efficiently. But in modern medicine, we have evidence-based symptom control. A depression patient A depressive patient has to give medicines which will immediately increase the dopamine levels. The exact dopamine, increasing the dopamine levels medicine is only prescribed to that person. The person will feel much better at that point of time, but the holistic treatment will act in some other way. Ayurveda focused on detoxification. That I have said, gut brain axis, when my whole body is purified, my brain will feel very happy. But the modern treatment of medicine service that pharmacological targeting of neurochemicals. They are targeting the neurochemicals. When they are targeting gabapentin, they are telling that I have to activate this, then the person will feel happy. I have to target serotonin, the person will feel happy. This is, of course, important. When the person is unable, the disease of the mental health of the person is unable to control. They are having suicidal attempts. In that case, of course, we need modern medication, modern help. But when the person is aware that I'm having some problem, I need to treat that. At that point of time, Ayurveda is the best solution. Stress reduction, as I said before, by Panchakarma and yoga. And modern system says psychotherapy, of course, this is also very important. Psychotherapy, when you talk with a person, half of the problem get released. And when you talk with a dedicated person, they know techniques, how to bring out the pain inside you. So this is a psychosocial support, very important for mental health patients. Ayurveda says about personalized diet and lifestyle changes. Now, personalized diet, we generally follow what fit the cuff, Sattvarajatama. The patient's specific prakriti, specific vikriti, we give specific diet. Simple as that. But in modern system, there are structured clinical management, irrespective of any prakriti. They suggest a structured treatment protocol that you have to, that also shows efficient results. But this is the difference between Ayurveda and modern system of medicine. Future integrative approaches. Now, how can we combine this? These are totally separate treatment of medicine, but the way we are approaching to mental health diseases, we can't just mentally stick to no, I have to treat this patient through this treatment only. If the condition of the patient is such that I have to intervene through any kind of treatment protocols, I have to approach that. Whether I have to report to someone, whether I have to send to the higher hospital, I have to send to some nationally level higher hospital, I have to do that as a doctor. So, first and foremost, promote interdisciplinary education. Both the disciplines has to know that in which case I have to refer. The referral system has to be very strong. Next, conduct and support clinical research on integrative approach. Without clinical research, no treatment protocol can ever stay ever valid. That is a main approach. Patient education. Patient doesn't know where to go. Patient doesn't know how to treat. So what is the effect of Ayurveda and modern medicine? No use. As it is mental health condition, half of the people doesn't want to go to doctor. If somebody is interested and they reach a doctor, they don't know where to go, how to treat. So patient education on expectations, benefits is very important. And commitment. I'm going 2 days, and in the third day I'm feeling no, doctor is knowing everything about me. I won't go. The treatment won't work. Careful monitoring of her drug reactions. I am giving ashwagandha, again I am giving anxiolytic medicine. I don't know how they are reacting, and allopathic treatment is also continuing. Ayurvedic is also continuing. The patient is suffering in some different way. This is not acceptable. So this is very important that we have a careful monitoring pattern. So this is how we can go through Ayurvedic treatment and the modern system of treatment. Both are very important, but the most vital is the patient, the mental health disorder who is suffering, because this suffering is silent. Healing takes time, and asking for help is a courageous step. This is very true. This is being this, through this many people has gone through, and they know how painful this can be. So, ending with this slide, thank you one and all for patience hearing, and I hope we can, with commitment and with integrative approach, we can do a lot of things through this mental health and through this era. Thank you so much. Thank you one and all.